Hello, my name is Renette from Nursing Tutor Network. At Nursing Tutor Network, we provide tutoring for nursing students who are in school and who are having difficulties understanding or passing their classes. In addition, we provide NCLEX review for nursing graduates who are getting ready to sit for their board exam. Today, I want to go over a question with you. This question is about tumors of the pituitary gland, specifically the posterior pituitary gland. A client has a tumor of the posterior pituitary gland. A nurse planning care would include which nursing intervention? A nurse planning care for a patient with a posterior pituitary tumor would include which nursing intervention? Select all that apply. We have 5 different answers. First, wait the client daily. Second, restrict fluids. Third, measure urine specific gravity. Fourth, encourage intake of coffee or tea. And fifth, monitor intake and output. In order to answer this question, you need to remember that the pituitary gland is a gland that is divided into the anterior and the posterior, and each section, the anterior or the posterior, secretes specific hormone. Tumors of the posterior pituitary gland can lead to diabetes insipidus because of deficiency of antidiuretic hormone. The other name for the antidiuretic hormone is vasopressin. A decrease in vasopressin or antidiuretic hormone can reduce the kidney's ability to concentrate urine, and this may result in excessive urination, thirst, and also need for increased fluid intake. Now, as the nurse, you will need to monitor fluid balance. You would weigh the patient daily. You would also measure urine specific gravity and monitor intake and output. You would also encourage the patient to take in enough fluid, because as you are losing fluid, you need to replace that fluid to help prevent dehydration. Drinks like coffee, tea, and other drinks that may have a diuretic effect should be avoided in a client like this, because the client is already putting out a lot of fluid, and we do not want that person to continue to put out more fluid, because we do not want that person to become dehydrated. You needed to remember that the posterior pituitary secretes oxytocin and vasopressin, and the other name for vasopressin is antidiuretic hormone, or ADH. Vasopressin stimulates water retention and help raise the blood pressure. So the answers for this question about the posterior pituitary gland tumor and the nursing interventions, number 1 would be an answer, wait the client daily. Number 3, measure urine specific gravity. Number 5, monitor intake and output. Thank you. This is Renette from Nursing Tutor Network. Our number is 954-235-8133. We can be reached online, or you can visit us online at nursingtutornetwork.com.